one chance, one place. Discovery Health Channel. Real life, medicine, miracles.
Matthew! Matthew!
This is extremely serious.
Reno, Nevada usually brings to mind drinking, gambling, and prostitution. But Reno is so much more. This majestic city has a small-town spirit where people help neighbors in need.
We all work together for a common goal, and that is to help the community no matter what the problem is.
Hi, Tyler.
Most of what we do is social work. Any paramedic who's been in the field for at least a year or so gets very good at it, whether they know it or not.
Okay, I need you to give me a thumbs up, okay?
The calls that I find most gratifying are not necessarily the medicals or the traumas, but it's the individual that you talk to. It's not giving drugs, starting an IV, but it's treatment all the same.
Let's give you a little oxygen here, dear.
Anytime a patient is very critical and walks out of the hospital, that makes it all worth it.
My name is Glenn Jones. Nice. I started in EMS in Reno about 18 or 19 years ago. I started in the dispatch center and worked there for 10 years and then went to paramedic school. And I've been working as a paramedic for about 8 years now here in Reno.
You need a little practice on your trick catches, bud. It occurred to Brad and I one day that we needed to have a Frisbee to toss around. It's a way to get some blood flowing, a little camaraderie, and maybe forget that sometimes the patients we run into are extremely sick.
Yeah, buddy. You're in there. The challenging part is, on a moment's notice, being able to go from a relaxed mode into almost a frenetic mode.
Rams of Paramedics, where do you need an ambulance?
Bird Eye, 606 Front Street.
What's the problem today, ma'am?
My husband said dial 911. He's having difficulty breathing.
Help is on the way.
Glenn Jones is dispatched to a respiratory problem on the outskirts of town.
That call came in as we were near the freeway on the very westernmost part of our boundary.
When I arrive on a scene, I try to present a real calm and even front.
What's this one? 608.
It is a front sometimes because it's kind of forced in a lot of situations.
Sounds like it's gonna be a code.
What's his name, ma'am? Tom.
Tom?
Ma'am, what happened?
He's asthmatic.
Okay.
He just took another Unifil, and when he did that, he told me to call 911.
Okay.
Tom Smith is unconscious and unable to breathe.
How old is he?
72.
Okay. So he has asthma. What other medical problems?
Well, lately he's been losing a lot of weight.
Bag him, please.
When you as a paramedic arrive on a scene, you are, in 99% of the cases, the one that is in charge, and you have to be in charge.
He's in the hospital in December, and again, very recently.
Yeah, you're on stage.
We haven't found out what the problem is. He turned really, really, really purple.
Yeah, he's still that way a little bit, huh? Really hyperventilating if you can. Okay, do you guys have an OPA in? Slip that down there. Sure. The wife was obviously very concerned about her husband.
Is he breathing?
He really doesn't seem like he is, but we're breathing for him, okay? The honesty that you relay to family members is always appreciated, and you need to let them know, you know, this person, your husband, is very sick. We're doing everything we can.
If Tom does not get oxygen soon, he will die. Tom Smith is still in full respiratory arrest. Paramedic Glenn Jones works to save him.
My main objective was to establish an airway.
Glenn inserts a tube into Tom's lungs to help him breathe.
No, that's okay, dear. Give me a syringe, Brad. I have one now. Just wire.
He's very, very hard of hearing.
He is.
Doesn't have a hearing aid yet.
Okay, we'll talk real loud then. You almost have two patients. I mean, you have the actual patient with a medical problem, but the family member becomes a patient as well, and they require your attention. Well, we're helping him, ma'am. He's breathing a little bit, but we're helping him. We're giving him some medicine.
He had a lot of mucus in there.
Yeah, he did, but when I looked in his throat, I didn't see any, okay? When a situation arises where you have a critical patient like that, there's a million things going on in your mind.
Here we go, 1, 2, 3.
Yes, ma'am, that's fine.
Tom's heart and lungs are struggling for oxygen. Glenn must get him to the hospital immediately.
Monday. Imagine waking up during surgery, unable to move or tell the doctor that something has gone terribly wrong. Don't miss Anesthesia Nightmares, Monday on Discovery Health Channel.
Tom Smith's lungs are filled with fluid. He's not getting enough oxygen. Paramedic Glenn Jones must keep him from spiraling down further.
Sir, can you hear me? Can you squeeze my hand? Squeeze with your left hand.
Okay. It seems like the more critical the patient, the easier it is for me to remember the sequence of treatment that I was taught in school.
Lay back, sir. Lay back. Go ahead and lay back. Just relax. Okay. Put your head back, sir. We got a tube in your throat, and we're breathing for you. Just keep your head down if you can for us, okay? We're just hoping you breathe here.
Glenn gives Tom medication to clear his lungs.
Sir, hold still for us, okay? You have a tube in your throat and we're breathing for you, okay? I know it's uncomfortable. You had a bad asthma attack. Try and hold still. Try and hold still for us. Hold still for us, sir. Relax. Hold still. Don't move around. You're doing good, all right? We're breathing for you. You just relax, okay? He's cyanotic, barely breathing. Went ahead and put him on the floor. Intubated him. He's had 2 inline albuterol treatments, a second with 1 milligram of atropine in it.
1, 2, 3. Okay. He did what? Ma'am, forgive me. Hang in there, sir. And thank you.
Oh, he's doing better than he was. Yeah. He's moving around and acts like he's trying to talk and make some communication efforts. So maybe we'll get lucky. We got there pretty quick, had a pretty good response time, so that'll be to his benefit. So we'll see. Kind of wakes you up. Who needs coffee, huh?
Paramedics, what's the problem there?
3 years old. He's very incoherent.
Okay.
Very pale.
We're on the way there, but what you need to do is you need to calm down to help her. Okay?
Glenn is called to a rural area of Reno.
That call came in as an unconscious person, and when we arrived on scene, I think we were all kind of surprised to see that it was a child.
Little Haley.
She was soaking wet, really shaking when we got here. Her heart rate was 120 regular.
And where's Mom?
Mom's right here.
Tell me what you saw today. What happened?
She woke up, and all of a sudden she's like, she just like, just limp, looking at me, but nothing. It's like she was dead.
You haven't noticed that she's been hot or anything? Okay. Well, we're going to take her temperature, and we'll see what that's looking like. And if it's high, then that'll kind of point us in the right direction, okay? Hi, baby. I know, sweetie. I know. I know. Mommy's right here.
She's right here.
Mommy's here, sweetie. Why don't you come on over here just so she can see you, okay?
Glenn thinks 3-year-old Haley Aramini had a seizure.
Just never noticed it.
Yeah, I know. It's scary to watch, huh?
Kids are difficult to deal with on an emotional level, especially if you have children of your own. With me, I always picture my own little girls and think of how I would feel if they were hurt or injured.
Hi, baby. How you doing, huh? You're not so good, huh? Sweetie, I just want to listen, okay?
There are few things that are as terrifying to a mother as when their child is seriously ill with something, but especially when they have seizures. It's a hard thing for anybody to see, but especially if it's your child that is going through it.
Hi, Funky. How you doing in there, huh? You doing okay? All right. Okay, here we go. 1, 2, 3. Hopefully everything will turn out okay for you.
First time I ever had to do that, so I
Yeah.
don't know how it would all work.
Hopefully the last. Well, so it was a little practice for you, huh? But hopefully you never have to use it again.
No.
Okay. Bye, sweetheart. Bye-bye. We'll see you in a little bit, okay? You feel better. Okay.
The mother was obviously distraught, but thankfully that case had a good outcome.
You know, I think this little girl's going to do fine. I'm not sure exactly what went on, but it looks like a seizure. And kids have seizures, so we'll see. We'll see. Little dill. Yeah. Pour some milk in here and you can mash that up too. There you go. Now mash her together a little bit. Good. My wife Gail is a nurse in the emergency room at one of the local hospitals here. She had 2 daughters who are now 13 and 16 years old.
I think that I've noticed a difference since I got married and became a step-parent. It seems like now I respond more emotionally to children that are sick or injured than I used to.
I am the Salmon King. Unless I'm cooking pork chops, and then I'm the pork chop king.
When I cook, I'm so focused on you know, making everything perfect and following a certain routine, and I think that I do the same thing when I'm working.
Okay.
Next, on another episode of Paramedics, long hours, sleepless nights, and adrenaline-filled rescues. Experience the chaos of medicine in the streets. Next on Discovery Health Channel. Real life, medicine, miracles.